What if your recovery after hip surgery could be predicted by something as simple as how fast you walk today?
Welcome to Dr. Mercola's Cellular Wisdom. Stay informed with quick, easy-to-listen summaries of our latest articles, perfect for when you're on the go. No reading required. Subscribe for free at mercola.com for the latest health insights.
Hello, and welcome to Dr. Mercola's Cellular Wisdom. I'm Ethan Foster. Today we're looking at why your walking speed before a hip operation and your everyday movement before a fracture can forecast how well you regain mobility. We'll also cover practical, drug-free ways you can support your hips if you're dealing with osteoarthritis.
I'm Alara Sky. Hip pain is widespread. Osteoarthritis is the leading cause and affects hundreds of millions of people worldwide. Many end up considering injections or surgery, but the research we're discussing shows that what you do before those interventions, especially how you move, has a measurable impact on what happens after.
A long-term study from Kyushu University tracked people scheduled for total hip arthroplasty using a simple 10-meter walk test before surgery. Researchers followed them for 5 to 10 years with patient-reported tools like the Oxford Hip Score and the Forgotten Joint Score 12. The strongest predictor of a better future? A pre-op gait speed of at least 1 meter per second.
That's important because walking speed reflects integrated health, muscle strength, cardiovascular capacity, balance, and coordination. The authors recommend adding that 10-meter test to routine pre-op assessments and using results to guide prehabilitation. If you're below the 1 meter per second mark, focused work on hip strength and range of motion before surgery could shift your trajectory.
A second study looked at older adults after hip fracture. Instead of pushing frail patients through demanding tests, the team asked about their pre-fracture walking habits, how often and how long they walked. 1 year after surgery, those who had walked at least 30 minutes at a time or moved 5 to 7 days a week recovered faster walking speeds.
Age, number of health conditions, and 2 simple activity scales explained over half the difference in 1-year outcomes in that group. That tells you that even modest, regular walking before a fracture isn't trivial. It leaves a fingerprint on your recovery months later.
If you're weighing hip pain decisions right now, it helps to understand osteoarthritis stages. In early stages, damage in bone spurs are minor and pain may be minimal. As cartilage wears and joint space narrows, pain, stiffness, and swelling appear during everyday activities. In the most advanced stage, cartilage is nearly gone and symptoms persist even at rest.
Women are affected more often, risk rises with family history, and extra body weight adds load with every step. Pain in the groin or thigh that can spread to the buttocks or knee, stiffness that makes walking or bending difficult, grinding or catching, and loss of range of motion are hallmark symptoms to watch.
Conventional options like NSAIDs and steroid shots are common, but they're not benign. Steroid injections can accelerate joint damage in a subset of patients and have a long list of systemic side effects when used repeatedly. NSAIDs can irritate the stomach, raise cardiovascular risk, and strain kidney function. These interventions can be useful short-term, yet they're not comprehensive solutions.
That's why gentle, consistent walking matters. Despite strong evidence, most adults aren't meeting basic movement targets. Walking activates anti-inflammatory pathways in cartilage and stimulates proteins involved in joint repair. It also delivers whole-body benefits. Lower risks for cardiovascular disease, type 2 diabetes, cognitive decline, and improvements in mental well-being, sleep, and longevity with regular brisk sessions.
There's also a cellular story. Walking supports mitochondrial health, which improves how you generate energy and can make you more resilient to age-related decline. Exposure to natural light during outdoor walks helps regulate circadian rhythm and supports melatonin production for better sleep.
If hip osteoarthritis is already on your radar, pair walking with simple, drug-free strategies. Gentle mobility work, hip circles, knee rotations, and bridge lifts can ease stiffness from prolonged sitting. Managing weight reduces the load across your hips, and even modest progress lightens joint stress in a way you can feel.
Nutrition ties in. Emphasize a bioenergetic approach by eliminating ultra-processed foods and focusing on healthy carbohydrates and starches, fruits and vegetables, and grass-fed meats and collagen to support your metabolism. Removing inflammatory seed oils, such as soybean, canola, corn, safflower, and sunflower, reduces linoleic acid burden that drives chronic inflammation and joint damage. Replace them with options like grass-fed butter, ghee, or tallow.
Nutrients that target joint integrity deserve attention. Vitamin K2 supports bone health and helps protect cartilage cells from inflammatory damage. You can prioritize foods like grass-fed egg yolks, aged cheeses, and fermented options such as natto or sauerkraut. If you need additional support, an MK7 supplement in the range of 80 to 200 micrograms is an option to consider.
Collagen inputs are useful as well. Homemade bone broth provides glycine, glucosamine, and chondroitin, nutrients associated with cartilage support and calmer joints. Many people find it a practical, soothing way to add these building blocks to daily routines.
Because inflammation and recovery tie back to cellular energy, supporting mitochondria with healthy carbs, daily movement, and safe sun exposure is a smart baseline. There's also research noting that dimethyl sulfoxide has improved hip flexibility in rheumatoid arthritis, underscoring how cellular environments influence joint feel and function.
Bringing it back to clinical decision-making, a measured approach makes sense. If injections or surgery are on the table, use the 10-meter walk test and prehab to improve your readiness. If you're post-fracture or helping a loved one through recovery, remember that pre-fracture activity levels are meaningful. Rebuilding a regular walking habit can help reclaim speed over the following year.
Before we close, let's put this into a direct plan you can act on. If you can safely do so, time yourself on a 10-meter walk this week and note your speed. Commit to regular walks. Aim for most days of the week or sessions of at least 30 minutes, adjusting to your current capacity. Remove inflammatory seed oils from your kitchen and add one joint-supportive food like bone broth or a vitamin K2-rich option. Support your mitochondria with daily daylight exposure and consistent movement.
Your challenge today? Complete a 10-meter walk test, write down your time, and start a walking schedule you can maintain. Pair it with one kitchen change, eliminate seed oils, or add a vitamin K2-rich food, and track how your hips feel over the next 4 weeks. Thank you for watching Dr. Mercola's Cellular Wisdom. We'll see you on the next episode.
Thanks for watching. Subscribe now and click the notification bell so you never miss an update. See you in the next video.